my name is Hannah. I'm a student nurse with SBC. I'm assigned to be with you today. Can you please give me SBAR report on your patient?
Sure. So we have room 620, Mr. Ryder Kind. He's a 67-year-old male. He is in with hyperglycemia and a stage 2 diabetic ulcer to his right heel. He has no known allergies. He's a full code, admitted under the service of Dr. Phillips. He's on a diabetic diet, which is 1,800 calories and a 2-gram sodium restriction. He presented originally to his primary care office with complaints of increased blood glucose for 5 days. It was running in the 300s. Baseline for him was around 120, and that occurred for about 3 weeks. He also had a non-healing wound to his right heel, which he did try a salt or soak, which was not effective. He's been a 20-year insulin-dependent diabetic, no tobacco use, and he drinks about 1 can of beer per week. Pretty much a sedentary lifestyle, but he does exercise by bowling once a week. Upon his assessment today, he's alert-oriented ×3, no headaches or dizziness. He does complain of bilateral lower extremity tingling. That's also been occurring for about 3 months. He has 20/20 vision with glasses. Eyes are perla. He has a steady gait with a 5x5 muscle strength. Respiratory rate is even unlabored. No coughing, wheezing, or chest tightness. He has no palpitations or edema noted. He has S1 and S2 heart sounds are appreciated. No murmur, rub, or gallop. Regular rate and rhythm for respirations as well. Pulse is palpable bilaterally. He has no complaints of nausea, vomiting, no change in his routine. Abdominal is flat, symmetrical, soft, and bowel sounds are heard in all 4 quadrants. He has no complaints of pain to his flank. He avoided 320 millimeters today. He does have a wound to his right heel, which is 5.5 centimeters by 2.5 centimeters and about 3 centimeters deep. Wound bed is pink. He has a dry, sterile dressing until wound keeper sees him tomorrow. Most recent vital signs for him: blood pressure is 128/70. Pulse is 76. He's on room air with an O2 sat of 96%. Respirations are 16. I did take his capillary blood glucose, and his most recent level is 290. And we have some insulin for managing that. He does have 1 IV that's in his right median vein. I assessed it and we flushed it with 5 milliliters of normal saline earlier. As far as labs, most of his laboratory studies are within normal limits. We do have a few pending tests: a CBC, CMP, a UA, and an AST. He has an A1C of 6.5, which is a little elevated from his last A1C 3 months ago of 5.2, so that tells us that his diabetes isn't being managed as well as it was. So as I mentioned, we do have insulin that we're going to give him, and I did order a meal for him. It's important that he has a meal here. Do you have any questions?
Why specifically is this client receiving this medication?
It's to help with hyperglycemia, as he is a diabetic.
What action does the medication have on the body?
It decreases the blood glucose by stimulating glucose uptake in the skeletal muscle and fat, and it inhibits the hepatic glucose production, essentially decreasing his glucose level.
When should you question administering this medication?
If we check his blood glucose and it's around 100 or below, so if it's within normal limits or if it's low, we should question. Also, if there's any change in his mental status.
Does the medication have a therapeutic serum level?
It does. The A1C that I mentioned earlier should be monitored every 3 to 6 months, and that tells us how well his hyperglycemia is being managed.
Which vital signs must be monitored?
We'll check a capillary blood glucose prior to administration, and we should always check his respirations and his blood pressure Q6 hours.
Which physiological parameters should be monitored when the medication is being administered?
Again, his blood glucose level, and we should always check for his his mental status.
Or if he was doing any strenuous exercising, if he wasn't.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
He should be able to recognize signs and symptoms of hypoglycemia, reporting that to the nursing staff as soon as he notices any symptoms. He also should be aware of his injection sites and will alternate those. And also ordering his meals before administration.
What interventions must be taught for taking the medication safely at home?
He should always carry candy or sugary snacks around with him just in case his blood glucose drops, and also check his blood glucose regularly. We'll also have him draw up his insulin prior to discharge just to make sure that he can administer it properly.
What are the side effects and potential adverse reactions?
The most common side effect we'll see is hypoglycemia. So again, any dizziness, anxiety, sweating, or drowsiness, and in the worst case scenario, anaphylaxis.
How will you know the medication is effective?
No signs or symptoms of hypoglycemia, and his blood glucose will approach or be within normal range, so 80 to 100.
Okay, those are all my questions. Thank you.
Great, so let's go ahead and give his insulin. Knock, knock. Hi, Ryder. How are you? Good. As you know, I'm Hannah, and I'm your nurse today. This is Hannah. She's a level 2 nursing student, and she's going to observe.
Okay.
Can you tell me your name and date of birth, please?
Yes. Ryder Kind, 67-year-old.
Okay, great. And I did take your blood glucose earlier. It's 290.
Okay.
So that's a little high, and I have your insulin. Can you tell me any potential side effects of hypoglycemia?
Yes. Dizziness, confusion.
Okay, great. Okay, so it's always important to check your 5 right before giving medication. So read the spread time, patient, and medication. For the insulin, you also need to check to make sure it's clear and check the expiration date. So you're good. And I have you listed as having no allergies. Do you have any allergies?
No.
Okay, great.
Do you want my teaching sheet?
I'm going to scan you in and say your name and date of birth one more time, please.
Ryder Kind, 67.
You're going to give 16 units. It is about 5 o'clock. I did order your dinner for you, so as soon as that comes out, it's important that you eat that.
Okay.
And where was the last place you got your medication?
My stomach.
Okay, great. So I'm going to give it to your upper right arm. Is that okay?
Yep.
It's not healing and has become increasingly painful. He did try soaking his foot in salt water at home, but did not provide him with any relief. I did assess the wound. It is 5.5 centimeters to 2.5 centimeters at a large diameter and about 3 centimeters deep, extending into the dermis. His wound base is pink. I didn't notice any tunneling or undermining. He does have a moderate serosanguis exudates. He does have a second diagnosis of diabetes mellitus type 1. His blood glucose has been consistent in the 120s until 3 weeks ago, where it has been in the 300s. He is on a special 1,800 calorie diet with 2 grams sodium restriction. He is awake oriented times 3 with clear speech and has a steady gait. He has all muscle strength in all extremities. No clubbing or edema noted. He has a peripheral IV line in his right forearm with a gauge of 18. His pupils are purple brown and reactive to light. Mouth.
Do you have any questions for me?
Regular heart sound. He has a regular heart sound is S1, S2.
I did print out some information about your insulin and your medication, so if you have any questions,
His lungs are
just
clear
let me
to
know
us.
later. I also printed out a diabetic diet for you. I know you had some trouble with compliance on that.
Symmetrical
And please look over that.
low tenderness.
And if you have any questions, I'll be back in a little later to check in on you.
is
Okay.
normal with an exception of blood pressure being
Thank you.
high and recently about 120/70. He has a pain level of 1 on a scale of 0 to 10. He has some pain labs, but his comprehensive blood cell count came back earlier, and everything is normal except for red blood cell count of 4.5. He also has a
Thanks so much for letting me observe. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, so we observed and reviewed his blood glucose level. We also checked for mental status and the location of his last injections.
Did this information affect your decision to administer the medication?
Yes, especially the blood glucose level, because if it was too low, we would have held the medication or called the doctor, and also the location of the last injection. It's important to rotate sites.
Did this information affect how you administer the medication?
More so with the location, because again, we want to make sure that we change the location of the last injection.
Okay, thank you.
Thank you.